today on our inaugural presentation. Our topic this afternoon is chronic disease management. Next slide, please. All right, we do have some ground rules to go over. Today's presentation will be recorded. However, Q&A will not be recorded. Please remain on mute. Please use the chat to submit questions. We will address them during our Q&A session. This is a safe place. There's no judgment. Participants agree not to share any personal information or opinions shared within the group outside of the discussion. Please silence your cell phone. Slides, documents, and unanswered questions will be emailed. Slide, please. All righty. Just as a disclaimer, this webinar is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. And slide. Right. My name is Joyce Balkenhand, and I've been in healthcare for over 45 years. I've been with the Coordinating Center for 2 years, and I have the role of nurse consultant for the Community First programs. My position entails providing consultation for client-specific care and home care coordination, health and community care guidance, and education and mentoring members of the CFP team. Ann?
Hi, good afternoon. My name is Ann Conway. I am as well a nurse, and I have been a nurse for over 20 years now. Prior to joining the Coordinating Center in 2020, I did care management services in the District of Columbia. And prior to that, my focus was on largely the pediatric population, young adolescent population, dealing with acute on complex chronic diseases.
Ready? Objectives for today include, after participating in this session, learners will identify common risk factors for chronic disease and how to manage them, comprehend how to get the most out of your medical appointments, understand how to work with your medical providers to develop a plan for managing their diseases, understand how to improve medication management, and appreciate the benefits of medical journaling. Slide. It's important to remember you're in charge. You've been diagnosed with a chronic condition. Now what? It's important to realize that you're really in charge of this. Let's start out by talking about what a chronic disease is. A chronic disease. When we talk about chronic diseases, it's important to understand what that means. It's a condition that lasts 1 year or more. It requires increased awareness and understanding of the disease and attending to it every day. Chronic disease does not get a day off. A chronic disease may limit your ability to take care of your personal needs, such as bathing yourself, eating, or walking. You might need extra help with taking care of your home or handling your finances. Having a chronic disease means taking medication and following a treatment plan. Did you know that having a chronic disease may increase your risk of developing another chronic disease? Some of the most common chronic conditions are very closely related, such as obesity, high blood pressure, type 2 diabetes, high cholesterol, and heart disease. Many of these conditions are risk factors for each other, and that creates a domino effect. If one chronic disease is not controlled, it raises the risk of developing another. Slide. Okay. We're going to talk a little bit about risk factors. A risk factor is something that increases a person's chances of developing a disease. There are some risk factors that cannot be changed, such as your age, race, gender, or family history. There's nothing we can do about those. The good news is there are some risk factors that we can change, and those are called modifiable risk factors. These are things like smoking, drinking alcohol, being overweight or obese, physical inactivity or lack of exercise, and diet. And to be truthful, these things are often not easy to change. But you can do it. There are lots of different programs available to support you through these changes. Speak with your doctor about what's available in your area. So, how can I manage my disease? Well, the first thing to realize is that don't assume you have the non-serious kind of this disease. If you've been diagnosed with a chronic disease, know that it's serious. For example, if you've been diagnosed with hypertension or high blood pressure, this is serious. Hypertension is a silent disease, so you may not feel what's going on inside your body. But please be aware, even though you're not aware of it, your high blood pressure is still there and potentially causing damage to your heart and blood vessels. If you've been diagnosed with diabetes, this is a serious disease that needs to be taken seriously, and it affects every organ in your body. There's no such thing as, I have a touch of sugar. Right? The good news here is that your disease is self-managed. Okay, so what does that mean? It means you're in charge. Each decision you make affects your health, what you eat, whether you walk or take the bus, how you take your medications. All that affects your disease and you're in charge. You're the most important person on the team that manages your illness. And by team, I mean you, your support system, your doctor, office staff, other healthcare professionals like your supports planner, your physical therapist, your dietitian, diabetes educator. But remember, you're number one. You're in charge of your disease. Next slide, please. Managing your illness. Okay, it's important to understand that you have options. Talk with your doctor about your treatment plan. If you're on certain medications that make you feel bad, please discuss them with him. Don't stop taking them. Another example is a diagnosis of, say, diabetes. Maybe you want to try to do diet and exercise before starting on medication. Discuss this with your doctor. You guys are a team, but again, you're in charge and you have the ability to change behaviors. Don't try to change everything at one time. Steps for change need to be spread out over time. Get the support you need to be successful. It's like running a marathon. You won't wake up one day and decide to run 26 miles. At least I hope not. Start by making small changes in your behaviors and build on your success. Keep a medical journal about what treatments you've tried, how it made you feel, and your next steps. And we'll be talking more about this later in the presentation. If you're ready to quit smoking, scan the QR code to access Maryland Department of Health smoking cessation resources. Many of the Maryland MCO plans also have a wealth of resources for smoking cessation. Next slide, please. So what's my plan? Always have to have a plan. And it's sometimes difficult to know when you should call the doctor. And especially hard on the weekends and after hours in the evenings. You don't want to bother him. You want to wait until your daughter gets home. There's lots of reasons that you may use to want to wait. So how do you decide? Well, there's different tools and resources available. The one I like is the stoplight tool. Ready? This provides a guide for what to do and when to call your physician by categorizing your symptoms into color-coded zones, just like a stoplight. This tool is completed by you and your doctor together. So let's take a look at this. The green zone, the green light, means I'm doing okay. Yellow is caution. Symptoms are getting worse. Don't know if I should call them or not. What do I need to do to control my symptoms? That red zone. My symptoms are really bad now. I'm getting into trouble. I need to call my doctor, go to the ER, call 911, something, but I can't do nothing. So let's take a look at a couple of these examples. Next slide, please. All right. So this is an example of a stoplight for congestive heart failure. And this was developed by CardioSmart, the American College of Cardiology. Can you make that a little bit bigger, please? Maybe. Oh, you're wonderful. Thank you. So if you've been diagnosed with congestive heart failure, you may have something that looks like this. Green is the all clear zone. This is where you want to live. This is where you want to be. This is the zone when you have no shortness of breath, no weight gain more than 2 pounds. It may change 1 or 2 pounds some days, but not more than 3 pounds in a day or 5 pounds in a week. You don't have any swelling of your feet, ankles, legs, or stomach, or any more than your baseline, and you have no chest pain. Now let's take a look at that warning zone. The caution zone is the yellow. Okay, thanks, Heidi. You could call your healthcare provider if you have weight gain of 3 pounds in a day or 5 pounds in a week. If the swelling in your feet, ankles, legs, or stomach increases. If you find that you are having increased difficulty breathing, for example, when you lie down, when you feel the need to sleep sitting up in a chair, those are signs of worsening congestive heart failure. Feeling uneasy, or you know something just does not feel right, that's a reason to call the doctor. If you have no energy or you're feeling more tired, more shortness of breath, a dry hacking cough, or dizziness. Now, if you get into the red zone, that's where you're in trouble. Okay, that's the medical alert zone. And you need to go to the emergency room, call 911 if you have a hard time breathing, if you cannot get relief from the shortness of breath, even while you're sitting still doing nothing, if you have chest pain, if you have confusion or can't think clearly. Now, let me remind you that this is congestive heart failure, and this would be something that you and your physician or medical provider would develop together based on your baseline, your symptoms, your circumstances around your disease. Everybody presents a little bit differently. This is just an example. Ready? When you look back at the slide, you'll see a QR code there. If you want to take another closer look at this, you have the ability to do that, or you can use the hyperlink. Now let's take a look at another plan. Let's take a look at diabetes. Next slide, please. Oh, thank you. Right on it, Heidi. Again, here's your QR code to access this plan, and you can also use the hyperlink included in this slide. A little bigger, please. Okay, so the stoplight we're going to take a look at is an example of one addressing type 1 diabetes. And this was developed by Saratoga Hospital for their patients. At the top, it provides you generalized instructions on what to do. All right, so things that your doctor would tell you to do, your nurse would tell you to do. Take your medications as prescribed at the same times each day. You want an even blood level of those medications as you go throughout your day. Eat a balanced diet spread throughout your day. Don't skip meals. Be as active as you are able. Test and control your blood sugar as ordered. Generalized instructions, right? Now let's go down into the stoplight portion where you'll see the green zone. This is all clear. This zone is your goal. This is where you want to be. You don't have any signs of high or low blood sugar. You're able to take your medications as prescribed. You're following your prescribed diet and exercise program. You're testing your blood sugar just like your doctor told you, just as prescribed. Your blood sugar is in the recommended range per your physician. He probably said, I want your blood sugar to be between, I don't know, 70 and 130, whatever it happens to be, but it's yours. You're able to keep your appointments with your medical providers, and you're following the Rate Your Plate guidelines. In case you haven't heard of Rate Your Plate guidelines, that means eating the right foods in the right portions, and there's information on that also within the slide deck. All right, let's slip into the yellow zone. This zone is a warning, and you should call your doctor if you're not able to take your medications as prescribed or test your blood sugar. Your blood sugar is under 70 and doesn't come up with increased carbohydrate intake. So if your blood sugar is under 70 and you drink some orange juice and it doesn't come up, or glucose gel, or you've had some tablets, those carbohydrate tablets. Remember, you need to eat 4 of those to get the carbohydrate level up. Milk. Milk is on here because it is a carbohydrate. It's preferable to drink skim milk in this situation because the fat in the 2% in whole milk blocks the absorption. So skim milk is best if you're going to go the milk route. Okay. Let the doc know if your blood glucose is over 200 on 3 tests in a row. If your temperature is over 101 degrees Fahrenheit, if you're vomiting or having diarrhea lasting for more than 6 hours, if you're not able to eat due to an upset stomach or vomiting. I kind of group those 3 together because when you're sick, that changes what your requirements for your disease might be. So you need to really consult your doctor on what medications to take and how to take them when you're sick. Sometimes infections can raise your blood sugar as well. Let him know if you have a new sore or problem with your feet. Let him know if you're not able to do your normal activities or follow your exercise program. And of course, let him know if you're having any trouble with dizziness, confusion, increased thirst or urination, or blurred vision. This could be that instability of the blood sugar, either high or too low. Okay. Now, in the red zone, this is an emergency. This is call 911 or have someone take you to the emergency room. This is not being seen in an urgent care center. This is go to the hospital, righty? It says here, if your blood glucose is under 20, I wouldn't wait until it got that low. If you're not able to get it up from that 70 and you've talked with your doctor, he may have given you more guidelines on, okay, if you don't get it up in X amount of time or it's below X, that's when you call 911. Call 911 if you're unable to stay awake, even during the day. If you're very confused or not thinking clearly, or you have difficulty speaking or you're slurring your words. Those are all reasons to call 911 or get yourself to the emergency room. Right? Next slide, please. Oops, I think we may have missed a couple there. Righty. So making the most of your doctor's appointments. Your doctor has such a small window of time with you. How do you make the most of the time you have with your doc during an appointment? Keep a list of questions and concerns to go over with your doc. And you want to prioritize them with the most important ones at the top of your list. Are you having any new symptoms? Do you need a flu shot? Are you concerned about how a treatment is affecting your daily life? Again, put your concerns in order with the most important ones first so you're sure those are covered. Take information with you to the doctor. This is important, such as your insurance cards, names and phone numbers of the other doctors you see, your medical records, your pharmacy name and phone number, a list of medications, including vitamins, herbal remedies, supplements, over-the-counter medications, not just your prescribed medications, but everything you take. If you take Tylenol PM every night, your doctor needs to know about that, as an example. Now, here's a tip. Some doctors want you to actually bring in your medications with you to the office so he could actually look at them to be sure there's no duplication or that we're all aligned with what you're taking. Great. Next slide, please. So again, making the most of your doctor's appointments. Consider bringing a family member or friend to the doctor's visit. They can help you in so many ways, not just as a support, but also to remind you of any concerns you wanted to discuss with the doctor. They can take notes for you. If you want some time alone with the doc to discuss your personal concerns, they can step out. That's not an issue. You want to keep your doctor up to date. So if you saw your doctor 3 months ago and you made a couple of trips to the ER, the urgent care center, the hospital, be sure your physician knows that. Let your physician know if you've had a change in your weight, your sleep or energy, or any new medication that you're taking, over the counter, herbal, prescribed by another physician, whatever it happens to be. Be sure you can see and hear well. as well as possible. Remember your eyeglasses. If you wear a hearing aid, make sure it's working and remember to wear it. Request an interpreter if you need one. So with an interpreter, it's really, really, really important that you understand everything your provider is saying to you. It's preferable if when you make your appointment, you request an interpreter at that time so they have advance notice. But if you forget to, that's okay. When you get to the doctor's office and you need an interpreter, please make sure they understand that and they can work it out through a special type of phone. Righty. Next slide, please. Oh, there's an app for this. There's an app for everything, right? So the Agency for Healthcare Research and Quality, it's a branch of the U.S. Department of Health and Human Services, and it takes research and it applies that research to actual real life situations in healthcare. Okay, it's done to keep patients safe and to help doctors and nurses improve the quality of care that they're providing. So they found out that patients often weren't getting the most out of the doctor's appointments, so they developed a tool to help with that. It's called the HRQ Question Builder, and this can be found online, or you can download the app on your smartphone. I have it on my Android. I use it all the time. And if I'm out and I think of something I should be telling my doctor, I can just type it right into my phone. It's good to have right there. So let's take a closer look at this. Question Builder Online. Be prepared for your next medical appointment. Create a list of questions that you can take with you, whether you're getting a checkup, talking about a problem or health condition, getting a prescription, or discussing a medical test or surgery. Whatever the reason for your visit, it's important that you be prepared. Using this tool actually makes it kind of easy. Okay, so you want to choose, first off, the kind of appointment you need. Now, let's suppose that you want to discuss a health problem. So check that off and go to the next question. Okay, so if you have a health problem, you may have a lot of questions. So you want to select the questions you want to remember to ask. Okay, so let's pick a few. Let's pick what's my diagnosis? Will I need more tests? What are my treatment options? What happens if I choose not to have treatment? And how much does this treatment cost? Okay, we chose 5 of them. All right, next question. Okay, so then what we need to do is to prioritize those questions. We're going to select the 3 questions that are most important for you to get answered in this visit. So I guess first off, I would say, what is my diagnosis? Because that's something I'd want to know. And I would want to know what my treatment options are. And what happens if I choose not to have treatment? Let's go to the next question. Okay, so take a look at this. They've done the work for you. Print your question list or use a previous button to change your list before printing. The appointment type is to talk about a health problem. So the 3 top questions that we checked off in our previous slide was, what's my diagnosis? What are my treatment options? What happens if I choose not to have treatment? So when you're in there with your doctor, you can actually take notes right on this or on your app. Okay, those additional questions we have on the list, but further down. So chances are if the doctor's talking about treatment options, they'll include talking about tests. How much the treatment costs, you may have to address that further on. But together, you can work on your disease management because remember, you're the one in charge. These are your questions that you need answered to have better management of it. Righty. Next slide. Next slide. Okay. So this is where Anne takes over. Anne?
Thank you so much, Joyce.
My pleasure.
So, medication management is another key component to managing your chronic diseases. Oftentimes, in many cases, many medications accompany many diagnoses and then are often ordered by more than one physician. Do you think you are aware of all of your medications? Do you think you may have a need for anything or any conversation with your pharmacist or your provider or medication reconciliation, a few key questions to ask yourself as you're looking to better manage your meds. How many medications are you prescribed? So prescribed meaning how many medications has a physician ordered and sent to the pharmacy to be received versus how many medications are you taking and how many of those are over the counter medications. So are you taking everything that the doctor has prescribed? Did you pick it all up from the pharmacy? Are there medications you've chosen not to take because you don't like the way they make you feel? Or perhaps in some cases, maybe you just forgot you're supposed to be taking that one. How many medications are you taking that provider A says take this, provider B says don't, and you have to make that decision on what to take. Do you get your medications from more than one pharmacy? Do you know what all of your meds are for and what those side effects are for? And do you feel comfortable reaching out to your doctor or your pharmacist with any questions? Next slide, Heidi. So Joyce showed you a couple of logs that kind of go into those chronic disease stoplight type deals. Here you have a list, or sorry, a log of medication. So it would be important to keep a medication log. Keep documentation of current medication names, both generic and brand. The difference between Lasix and furosemide, right? Important designations. Your medication dosage, how much is ordered, as well as the administration instructions. So are you taking it every 12 hours or twice a day? Is it one tab once a day or one tab twice a day? Those type of things. Why are you taking this medication? What is this medication for? What are the side effects? And what are the descriptions? So it would be important to keep color and size of medication. There are times by where a manufacturer will have a change, or there could be a back order and the pharmacy has to go to a different manufacturer. The same medication could have a different color and a different size, or a different, many medications have imprints on them. It could have a different imprint. So if you have that information at your fingertips, then you would know and you would be able to ask that question to ensure you're getting the right medication when you pick it up from pharmacy. Next slide, please. So again, the medication logs are important to take to all of your provider appointments. So your primary care, any specialty providers, again, that log will help to avoid duplications. I mentioned a moment ago, furosemide versus Lasix. All of your doctors need to know what you're on so that you're not taking the same medication or higher doses of what is, what has been ordered. Ask questions and learn about your meds. Be very clear with your doctor if you want to know something and document that. As well, be clear about any side effects. Some medications you may be ordered are due to side effects that one medication, that you can experience from one medication. You want to make sure that you don't stop taking something because of the side effects. Talk to your provider about it. It may be a dosage. You may need to be on a different medication, but it's important to be aware of what those side effects are so you know if it's medication A causing it or medication B. Next slide, please. So how can you take those steps to better manage your medications? It's important to develop a routine that works for you and your family if you have others that are involved in your care. Medications need to become a part of your daily routine. Meaning they have to be in the forefront of your thought, not, oh, I have to take my medications now. You want to make sure that you get up, you brush your teeth, you take your meds. It follows along that same routine. Pay attention to administration times. Again, morning, any time in the morning, or is it due at 8 a.m.? There are some medications that you can't eat, either before or after for a period of time. So understanding what that looks like for your routine is important. When do you refill your medications? Are you on an auto refill with your pharmacy? Does the pharmacy need to contact the provider to get a new order for that refill? Are you waiting until you're taking your very last dosage before you call the pharmacy to make sure that that refill is in place? You want to work that schedule into your routine as well. And then filling a pill organizer. If you use one, or if you're interested in using one, who is responsible for filling that and at what time? Are you filling it for a week? Pill organizers come in a week. They come in months. They divided by days, morning, AM, PM. things like that. So please make sure that whatever you choose to use works for you and as well with your family or whoever else is providing care. In the picture, you can see this pharmacy provides bubble packs and all of the medications that are due at those specific times. This outlines breakfast, lunch, dinner, and bedtime are in there. You can see on the one side that the opposite side of the medications, it lists those informations, dosage, route. It even gives you a description and what that pill looks like. Again, so you're armed with information in one place to make sure that you're managing what that looks like correctly. If those are things you're interested in, contact the pharmacy. The pharmacy can help put you in touch with or tell you what their process is for creating those bubble packs, or helping you with medication management as it pertains to your insurance. Next slide, please. So another important factor, and we talked a moment ago about duplications, try sticking to one pharmacy so that medications are, they go through those double and triple checks. If you have one pharmacy, your entire medication profile is in the system. So if you're taking Lasix and you have a provider submit an order for furosemide, then the pharmacist is aware that that's potentially a duplication, and they'll reach out to the provider to clarify what that looks like, and perhaps get another medication or change doses or what have you. If you're getting medications from more than one pharmacy, then sometimes those double checks they don't occur. So as well, creating a relationship with your pharmacist so that you are comfortable going to them if you have questions or asking for information is important. Again, it talks about, we decrease duplications. You can get information from pharmacy, and it's an important engagement. Next slide. So we've talked, Joyce has shown, again, the stoplights, talked about the questions to ask for the providers. I've gone into medications and the importance of keeping those logs. Well, how do you keep all of this together, right? You've got numerous amounts of probably documents that go, may or may not go with you to each provider's office. You have providers that potentially are in two different electronic charting systems, so they don't see the good information from the other provider. Medical journaling can be a really good tool if it's kept up and if you're consistent with it. A medical journal or a personal health diary is used to keep track of your health. It can be a notebook. It can be a folder with all of your appointments, discharge instructions, medication notes. Take that journal with you to all of your appointments, especially if you're changing from provider to provider or have multiple providers involved in your care. Again, if there's someone else on a personal level that's helping you with your care, a family member or a community member, make sure to discuss that journaling with them as well, because they can also, help you with that journal. They can provide information if necessary, or if you're in a position by where you can't necessarily speak for yourself at the time of the provider's office, then that family member can have that journal with them and you can go through what that looks like. Next slide, please. So again, it can be as simple or as detailed as you need and as you want it to be. So things like keeping a running log of how you're feeling. Joyce mentioned it as well. What is your baseline and what deviates from that? Blood pressure logs, blood sugar logs. So, a blood pressure log, date, time, this is what my blood pressure was, this is when I took my medications, this is what I'm experiencing. Same with blood sugar. It could be a list of questions to ask the provider at the next appointment, medication management pages. So all of those things can go into that medical journal. Next slide. So logging activity associated with symptoms. So for example, again, managing your baseline and what is correct for you or what you know to be true for yourself. If you get out of breath going up a flight of steps and that's something different, it's important to put into your journal. If you feel your ankle swelling after walking, and again, that is different, it's important to put it in your journal. I can speak again from experience. Family member will call me saying, I've got XYZ going on. Okay, so you should contact your doctor, talk with that about it. They make an appointment. XYZ is not happening at the time of the appointment. So family member did not ever bring it up. So the doctor is not aware that whatever XYZ was taking place. That's important information, even if it's not, you're not experiencing that at the time of the appointment. Conversely, don't only log the bad symptoms or what may be an escalation of disease. If you're on a new medication and you do not get out of breath going up a flight of steps, document that. Celebrate those wins. Let the doctor know that medication may be working, or maybe there's something Joyce talked about diet. Maybe there's something you changed that is also assisting. Document all of that. That journaling can help the providers connect the dots for your healthcare. It provides a timeline of events that are in your own words in real time as you're going through them. You don't have to get to appointment and remember, oh, well, last month, last week, an hour ago, what have you. It can help identify patterns, areas of needed change, or again, like we said, celebrations of good things in your management of your disease and medications. It can help you maintain accountability for your healthcare. So by journaling, you are maintaining the charge of that. Okay? It's keeping you accountable. You know, oh, you know what? I just documented that I ate a whole bag of potato chips and my blood pressure was up an hour later. That makes perfect sense, and you can see the cause and effect there. So maybe you don't eat the whole bag next time. I understand you can't just eat one chip, but maybe it's two or three and not the bag. You learn to manage that when you see it written down like that. Next slide, please. So again, in the very beginning, Joyce message to everybody that you're in charge. Medication management, journaling, that keeps you in charge of your healthcare. It is your words, it is your considerations, it's your concerns and your successes. So please make sure that if that's, it's not easy to journal all of the time. You have to keep up on it, but it keeps you in charge of your disease and your diagnosis.